Hey YouTube, my name is Dr. Daniel Kaplan and my mission is to make psychology accessible to all. In today's video, we're going to talk about histrionic personality disorder. So if you like what you have to see, if you learn something new, if you find the content valuable, hit the like button, subscribe, click the notifications tab. But without further ado, let's talk about histrionic personality disorder. So with histrionic personality disorder, there is a strong emotional reaction that you tend to see. And we see a desire to be the center of attention. So these individuals might feel as though they're always on stage, putting on a show. They might feel as though they need the approval and validation of others. So if we were to ask other people how they describe an individual they know with histrionic personality disorder, they might be described as demanding, self-centered, vain. And in terms of suicide, if we were to compare borderline personality disorder and histrionic personality disorder, we see a difference. In both cases, there are suicidal behaviors, but the motivation is different with histrionic personality disorder. It is oftentimes to manipulate other people or to get their attention with histrionic. Now, let's talk about the DSM-5 criterion. Everybody might have some symptoms of each of these conditions, but in order to meet the criteria for a disorder, you have to have 5 or more of the following symptoms. So 1, not being comfortable without being the center of attention. 2, being inappropriate or sexually seductive. 3, rapid or shallow expression of emotions. There might be labile affect, quick changing of emotions. You might see people use their physical appearance to draw attention to themselves. They could be very impressionistic. They might exaggerate their emotions or theatricize their emotions. They're pretty suggestible, and they consider relationships to be closer or more intimate than they really are. As I said, you don't need all of these. You need 5 or more. So each person's appearance for this diagnosis is going to look slightly different. So how do we explain histrionic personality disorder? So from a psychodynamic perspective, there is a suggestion that there were these unhealthy relationships with their parents. So their parents were either cold and they felt unloved, and they developed this fear of abandonment because of this cold parenting. And as a way of addressing this, they learned to either behave dramatically or create crises that would draw attention to themselves and require people to act more protectively. So if their parents were distant, aloof, they were presenting as if there was some level of abandonment, you could see how creating crises might draw people to say, oh my goodness, I got to deal with this. Now, from a cognitive point of view, the suggestion is that people with this disorder hold the general assumption that they're helpless and cannot take care of themselves. So they seek out others who will take care of them or meet their needs. And from a sociocultural or multicultural perspective, this might be part of society's norms or expectations. And it might be the vain, dramatic, and selfish behavior may be an exaggeration of femininity, as our culture wants to find it. So these are kind of different theories. Now, in terms of treatment, the cognitive theory focuses on breaking the belief that people are helpless. And we want to foster a sense that people can take care of themselves. They can develop better and more deliberate ways of thinking, then they can solve their own problems. So that's a cognitive mindset. From a psychodynamic point of view, and separately, but related to the issue, a group therapy point of view, the focus is on dependency and breaking the cycle of dependency. So what about drug therapy? What about pharmacotherapy? So research suggests the previous treatments are helpful, but when it comes to drug therapy, not so much, right? So the drug interventions or pharmacotherapies would be more to address things like depression that are linked to this condition, but not actually histrionic personality disorder. And what's interesting is that I said that with personality disorders, it's hard because there's more resistance to treatment. And many people don't come into the treatment room. But unlike many of the other personality disorders, when it comes to histrionic personality disorders, these individuals are more likely to seek out treatment on their own. But it is challenging to work with individuals who have histrionic personality disorders because they can be very demanding. They can, we call it acting out behavior. They can throw tantrums. They can engage in seductiveness, which creates some kind of sexual transference to the client, to the therapist, I'm sorry. And they might seek to please the therapist rather than meaningful gains, meaningful growth. So this is histrionic personality disorder. I hope you found the video useful. By now, you should be able to identify the criteria for histrionic personality disorder. You should be able to know the hallmark feature. You should be able to state a few theories as it's related to what causes histrionic personality disorder and several treatments. So that's histrionic personality disorder. And as I started, if you found this video useful, hit the like button, subscribe, click the notifications tab. This will help YouTube bring the video to a larger audience because they count these things. And that's how they determine whether this was a meaningful video. For me, I love when I get a comment. So if you have a question or a reaction to the video, please put it in the comment section below. I read and respond to every comment. So yeah, let's turn this into a learning community. With that, I want to thank you again for watching the video. Take care, everybody.